What happened at Grenfell has changed a lot of people's lives.
There are a lot of residents, silent majority, never come up, have their curtains always down, can't even bear to see the tower. They might never come to us for help.
My name is Miguel Alves, and I've been affected by the fire because I'm a survivor. I was in the building when the fire happened.
Abbas Dadu, resident of Lancaster West Estate.
My name is Dr. Mina Nathan, and I'm a GP that works locally here in North Kensington.
My name's Nabil Shukair. I'm a bereaved for 6.
Hello, my name is Rasha. I'm from Egypt originally, and I'm the sister of Rania, who was one of the residents of the Grenfell, who lived on the 23rd floor with her 2 children. When this happened to Rania and her children, we had a very big shock and trauma in our lives.
My name is Ali. I'm 16. I live in the area. I've been affected by the Grenfell fire, lost a couple of friends. When that happened, I didn't know how to control my emotions. We just started having all these kinds of anxieties, all that stuff.
Our key worker told us there is a support, health support, that we have a right to access it, and also support for trauma.
I've been through this talking therapy for a long time, and I had so many sessions before the fire, after the fire. Talking doesn't help me much. Sometimes depends to the person. If it's trauma, they need to go very deep to deal with that issue, so probably they need proper expertise who can deal with that issue.
At the beginning, they got it totally wrong. They were dealing with my low mood depression when instead they should have been dealing with my grief. I've done so many sessions, and then we realized it wasn't working. And now we've had to relook at it.
My wife and my son and my daughter, all of us, they've been, with the therapists, since we asked. I feel guilty because I was survivor, and some of the people on the building, they didn't survive. That is a conflict. That therapy, they helped me to go through.
I would tell our community that if you need a professional help, it's available everywhere. Seek that help by going to your GP, asking them, or by going to your community center.
When a patient comes to us, if they've got concerns about their mental health and well-being, we can refer to our mental health providers and provide psychological support. However, we know that this doesn't fit for all.
When we had the Asian doctor, she referred my child, who is 3 years old at that time, to child therapy, trauma therapy in the Curve with the NHS. It is so important to be able to speak in Arabic, because I speak Arabic, and I rather to have doctors or specialists who are Arabic, especially if it is related to mental health. My child had a trauma, so he had many symptoms such as bedwetting, being isolated. He wasn't talking to anyone. The doctor and the school, they designed a program which consists of behavioral and speaking therapy, where he is now less isolated, so he can mingle with his friends.
I've had a particular patient who was under a lot of distress, and that particular patient wasn't ready to go into psychological services. We found that our patient engaged incredibly well with one of our therapists through the massage and reflexology, Reiki. That particular therapist was then able to communicate with me when there were concerns highlighted, and after some short-term support from that particular therapist with the complementary therapy, I was then able to engage this patient into psychological clinical services. That patient has made a huge recovery now.
Well, personally, I think like just more like engagement with the area, just show more trust to the people, say that the NHS are there to help them. The NHS should like kind of invest on like kind of more like music therapy. Some of the young people around this area, they're like more engaged with like more like music. Music is like their way of speaking their emotions.
There's so many things that I have to keep fighting for, challenging, asking for, like as if I'm begging, you know, to get some things for myself, for my family.
To me, I would like if the person you're talking to in the NHS, especially if it's mental issues or if it's your GP, to see what are your issues, what are your needs. If that person needs is met and sorted, if my housing needs are sorted, I will have much less headache, much less worry, and it will give me a peace of mind, a bit of break.
We are continuously learning from our communities and our patients.
One of the biggest problems is getting the families and the people affected to recover, and the help hasn't been given to them because they don't know about it, or it wasn't advertised, or they wasn't told. There's a lot of families and people affected at different levels, and you really need to ask these people, these families, there needs to be more help given so it can be more supportive, because the inquiry is going to run for a long time, and even the inquest as well after that, which is another thing, is that you have to look at the support and the help that is needed extra. We can't just make a plan now for the next 5 years. It's going to go over and more, and we need to look at it more. And if more help and support is needed, then it has to be re-looked at and reevaluated in every and any way, because everybody's different and it really needs to be looked at.
The NHS don't have a lack of support, but they have lack of, I think, of people who are culturally appropriate.
We have many different layers within our community. A lot of individuals, they have different individual needs, which is very hard to deal with. But they are willing to help, and they are doing their best to help.
With the help of the NHS, with the help of the therapist, they help me a lot, and I'm feeling much better now.
I've recently started seeing the NHS's Grenfell Health and Wellbeing Centre. Good service, everything. Personally, the NHS helped me alright, like helped me good, because like some of the activities that they put out, I engaged with some of them, and I felt personally they could help like other people out there.
One of our ultimate aims is to build resilience in the community, especially through non-clinical methods as well and ways. Essentially what we want patients and our community to do is to also be involved in taking responsibility for their health, and very fortunate to have local health partners in the community where we can signpost our patients to, and this would include ensuring that it culturally met the needs of our patients. Examples could be counselling in specific languages or psychological therapies in specific languages.
Health Partner Program is a good initiative, and considering involving different group of community, I think it will achieve a lot. But I would like to ask, and I have already asked, we need RBKC and Education Department to be a partner in this.
Well, the stuff that I enjoy doing was helping out like the area with the cooking, also some of the food festivals we did around here, as food is a big thing to bring everyone around the table, which is a good experience.
The exercise is very good for mental health, not only for the physical health, but mental, because at least if I'm playing for 1 hour and a half, during that 1 hour and a half, you know, I will forget all my problems.
I have hope there could be a good future coming, but that's if we work hard to get that to happen.
I think future going to be bright if we all stand together